I met Alicia on a networking Zoom in the fall. And after hearing just 2 minutes of her story, I was intrigued. And so we got together on a Zoom after that. She sent me additional information. And so my husband, I'm a retired nurse, he's a retired physician. We watched the videos, we did a little bit of research and, decided we wanted to get started even before we dove even deeper in the research. So we did start on the X39 patch in mid-November. Um, and then, like I said, after that, we kept researching even more, watching more of the videos. And one of the videos we watched was on the Eon patch. And with it, they showed some thermography of animals after being patched and the difference in the inflammation in the animals after being patched for 20 minutes. Well, I do thermography rather than mammograms, and I was due a thermogram. So I called my thermographer and asked her if she knew about the patches. She said no, that she did. Well, that she had heard of them. She thought she might have a couple of clients that were using them, but she didn't really know anything about them. And I said, well, would you be willing to do an experiment? And she said yes. So January 7th, which is only a couple of weeks ago, was when we scheduled my thermogram. And so like I said, I've been patching with the X39 since November. That morning, it was an early morning appointment, so I didn't put up the patch on that morning. I went in, we did the first set of images. And then when those images were done, I put on the X39 below my belly button and Eon, which was the first time I had used it at the pressure point on my below my right elbow, because I wanted to make sure that they wouldn't interfere with the images. We waited 20 minutes and repeated the images. And so she told me, she said, I'll put them in a comparison template and send them to you tomorrow. And she was really impressed with the differences in the images between if you see on here, the ones on the left are before and the ones on the right are after. And so after only 20 minutes, you can see that there's much more of the blues and purples and less of the reds and yellows. And neither one of us really expected to see much after only 20 minutes. We were both very skeptical. But she called me the next day, saying, I want you to see this. I really am kind of excited about what it's showing. So I've been using both patches since then. And when I go back next week, we're going to determine, I think probably I'm 68 years old, soon to be 69. So I know I need to give at least 7 months before I really expect to see anything. But I think we're probably going to repeat the images at 3 months, 6 months, and then of course in a year.
My goodness, that's very powerful. What else have you noticed, Pam?
Well, before the patching, I was having some trouble with my left knee. Just like I said, I'm 68. Things happen, and just getting up from the couch. You just it's aching or buckle a little bit. Some things that having trouble going up and down stairs. And now I don't really have any trouble at all. I'll have the occasional twinge, if you turn the wrong way or something like that, but not nearly the trouble I was having before.
That's
And what about Dr. Gene, your husband? What has he seen as well?
He hasn't seen a lot of major improvements, but Gene is my husband's. There's a big age difference between us, so he is 89 and will be 90 in May. So he's going to take a little longer to see the benefits, but he is seeing some. I mean, there are some small things here and there, but we don't expect to see much for a little while with him.
Well, how excited were you were you just in shock when you saw these images? I mean, the mama, I can't say that word. When your scan tech called you and she said, "I'm shocked," and then you looked at him. I mean, what was that like when you saw him? I mean, it's phenomenal. It
It was. And like I said, neither one of us expected to really. She said, Pam, 20 minutes is just not going to, we're not likely to see much. And so, we are, she's going to be just like I am, a little more skeptical till as far as, you know, going forward with promoting it too much as far, but still wanting to share it for sure. But I think she's like me. We want to see that second set of images that, that shows a difference after being on the two patches together for a while.
Grace, can you throw the image back up one more time? Give her just a second. There we go. And Pam, can you explain, like you did for me just a minute ago, just briefly, like from the left to the right, saying that upper right hand image, the differences there and the importance of those color changes.
In the on the far
Upper
right,
right hand side, the
yeah,
the small, uh-huh.
the smaller ones, yeah. Well, you can see there's a big difference between on the right-hand side, there's much more blue and the lighter purples, which are lighter colors. The reds, the yellows um, are areas where things are hotter, where there's a little more inflammation. There's more. So there, on that very top image, you can see there is a big difference between the two pictures.
Right, which means in 20 minutes, based on this scan, a major reduction of the inflammation. Is that
Right.
what it would lead to
A
believe, right?
definite cool, yeah, a definite cooling down in that time frame.
Yeah,
I mean,
in 20
it's a
minutes.
massive difference. Like look at like under the, before Life Wave on the left, and then after, like even in the armpit area, it was red hot, angry, red, and then it went completely yellow, greenish, bluish right there in that whole in that one area. Like where lymph nodes are, for instance, underneath the armpit, where that's where in the same as with that. That's a big. That's to me, that's a huge difference right there.
And then you're back on that bottom left image. I mean, I guess the purples are the ideal color, and it went from the blues to almost the tons of purple too. So, and that's the goal, correct?
Right. Yeah.
So, well, that is exciting. So, cooling down and getting less inflammation, and we know the body can respond better to healing, repairing, and restoring when we have less inflammation in our body. So,